In this video we demonstrate how a blood culture can be sampled with a closed system from a newly inserted peripheral catheter to avoid additional venipuncture. As soon as a catheter has been used or if it was already in place, this procedure cannot be performed due to the risk of contamination of the blood culture. In normal conditions, there are no bacteria in the blood. However, in case of severe infections, bacteria may be present in the blood and cause bloodstream infections. To identify these bacteria, blood is sampled in a blood culture bottle and cultured in a liquid medium. However, bacteria are also present on the human skin and in the environment. If these bacteria enter the blood culture bottle during sampling, the blood culture bottle will be contaminated with bacteria that do not originate from the patient's blood. These bacteria will multiply during the incubation and cause false positive results. To avoid blood culture contamination and obtain good quality results, blood must be sampled according to specific blood culture sampling procedures which are demonstrated in this video. Blood cultures should be sampled in case of severe febrile illness, so there should be fever or hypothermia combined with general signs of severity or signs of a local severe infection. To sample a blood culture, you need a blood culture request form, a permanent marker and a pen, an alcohol-based hand rub, and minimum 1 pair of non-sterile gloves. For disinfection, you need a timer, 5 dry compresses per blood culture set, and 2 disinfectants. We prefer to use 70% isopropyl alcohol for the first step of skin disinfection and disinfection of the blood culture bottle and holder, and to use 2% chlorhexidine gluconate in 70% isopropyl alcohol as a second step for skin disinfection. For blood culture sampling, you need a tourniquet, you need an IV catheter and its lock, tape to fixate the catheter, a 5 ml sterile syringe for a child or 2 10 ml syringes for an adult, a 23 gauge needle for a child or 2 for an adult, and a rack to hold the syringe, a sharps container and a biohazard container. We strongly recommend positioning of all materials at the side of the dominant hand to avoid crossover of the arms during the procedure. Once you have arranged your workplace, you can start the procedure. Check if the blood culture is not expired. Then check the patient's identity by asking his name, age and gender. Indicate your volume of blood you need to sample per blood culture bottle according to the age of the patient. In adults, we sample 2 blood culture bottles of 10 ml, so indicate which bottle you will sample first and which second. Inform the patient or his caretaker about the procedure while you disinfect your hands with alcohol-based hand rub before you touch the patient. Position the patient and look for an appropriate venipuncture site. Apply and fasten the tourniquet about 10 cm above the puncture site and ask the patient to make a fist. Look for an appropriate place for venipuncture. Palpate the vein. Once you've identified the vein, you can loosen the tourniquet. Clean the patient's skin at the puncture site with 70% isopropyl alcohol. Apply vigorous friction. If the wipe is visibly soiled, repeat with another wipe until the wipe is clean. Wait for 30 seconds to 1 minute to allow the alcohol to dry. Meanwhile, you can remove the caps from the blood culture bottles and place the bottles in a rack. Disinfect with 70% isopropyl alcohol the rubber septum of each bottle. Now disinfect the puncture site again with 2% chlorhexidine gluconate in 70% isopropyl alcohol. apply vigorous friction again and wait 30 seconds to 1 minute to allow the alcohol to dry. Do not touch the puncture site anymore during the rest of the procedure. Put on gloves. Open the package of 2 10 ml syringes and 2 23 gauge needles for adults. For children, 1 5 ml syringe and 1 23 gauge needle is enough. Leave the syringes and the needles in the package to keep them sterile. Open the package of the catheter lock, but leave the lock inside to keep it sterile. Fasten the tourniquet again and remove a catheter from its package. Do not touch the puncture site. If you've touched it, repeat antisepsis before proceeding. Puncture the vein with a catheter. When blood flows, make sure to keep the needle stable and in place. Slip the catheter over the needle into the vein. Take a dry sterile compress and put the compress under the needle on the skin of the patient. Withdraw the needle completely and discard it directly into the sharps container. Stabilize the catheter with a finger or a small tape during the whole procedure, but make sure that the dry compress does not touch the catheter hub. If the catheter insertion fails, use a new sterile catheter and a new puncture site and repeat the whole procedure from antisepsis onwards. Take the syringe in a sterile way from its package. Make sure nothing touches the tip of the syringe. Connect the syringe firmly to the catheter hub. Aspirate blood until you have collected the volume required for the age of the patient. Release the tourniquet. Press on the vein just above the puncture site to stop the blood flow. Remove the syringe from the catheter. Place the syringe in a rack with the open side facing upwards and make sure nothing touches the open side of the syringe. For adults, you can now aspirate a second time 10 ml of blood for the second blood culture bottle using a new sterile syringe. If necessary, you can hereafter take other blood samples for additional laboratory analysis. Attach the catheter to the skin of the patient using an adhesive tape. Connect the catheter to the infusion set or lock it with a cap. Take the capped 23 gauge needle from its package and take the open blood-filled syringe from the rack. Attach the 23 gauge needle to the syringe in a sterile way. Uncap the needle carefully. Next, inoculate the blood culture bottle, while the blood culture bottle is placed in a rack. Do not hold the blood culture bottle by hand when you inoculate the bottle. Carefully puncture the septum of the blood culture bottle with a 23 gauge needle. The blood will flow in the blood culture bottle. Wait until the syringe is empty. Once empty, remove the syringe and needle from the blood culture bottle. Throw the syringe and needle directly in the sharps container. Take the blood culture bottle out of the rack, mix it gently, and put it back in the rack. Remove your gloves and disinfect your hands with alcohol-based hand rub. Identify now the blood culture bottles with the patient's name, the patient hospital number, the date and time of blood collection, and the sampling site. Complete now the blood culture request form with the date and time of sampling, the type of bottles, your initials and any relevant comment. Peel off the barcodes of the blood culture bottles and paste them on the request form. Check if the bottles are labeled correctly and transport the bottles immediately to the laboratory. Keep the transport time as short as possible and maximum 4 hours. If the transport is not immediate, keep the blood culture bottles in the dark and at room temperature and never store them in the fridge.